Hello and welcome to our webinar today. I'm Rachel Helms. I am one of the Assistant Directors in Alumni Relations here at Middle Tennessee State University. We are so happy you could join us today. We have some very special guests who will be talking about a topic close to many of our hearts, the health of our family pets. Dr. Amy Shirley and Michael Shirley met while both studying animal science at MTSU. Dr. Shirley went on to graduate with her veterinary degree from the University of Tennessee, Knoxville in 2005, and they now own the veterinary practice Family Pet Health here in Murfreesboro. Michael and his brother Stephen host a popular podcast entitled The Family Pet Podcast, which is all about how to be a better pet owner. Dr. Shirley, Michael, Stephen, thank you for being here, and I will just turn it over to you.
All right. Well, thanks for joining us, everybody that's watching today. Go ahead and if you have any questions that you want to make sure we cover today, put them in the chat box down there and we will get to them. We will definitely not end this podcast today, or this recording, this webinar today without answering your questions, or at least attempting to answer them and getting you a good answer. So what we're going to do today is a little different than maybe most webinars that you've watched, in that we are going to just record a regular podcast episode for ourselves. This is kind of doubling as double content, right?
Content creation.
All right, so we're going to get started. We would just, if you do like podcasts, you can find the Family Pet Podcast wherever you subscribe to your favorite podcast. So let's go. You ready? Okay. All right. Well, welcome into the Family Pet Podcast. It's the podcast for curious pet parents, where we believe the more you know about pet healthcare, the better pet parent you can be. I'm your host, class of 2006 from MTSU, Michael Shirley, joined by non-degree alumni, Stephen,
yes,
brother.
Yes. Non-degree alumni.
You do have a degree. You just
I have a degree from a different university.
We won't name them, or if we do name them, we'll keep them out. So, because this is the Blue Raider alumni podcast episode of the Family Pet Podcast.
But I do have 17 hours that I took at MTSU, and I have a son who graduated from MTSU in 3 years. And I have
he did it wrong.
He did it in 3 years. And I have a daughter-in-law who graduated from MTSU with a 4.0. So
overachievers. I married somebody that had a 4.0. Well, I don't know if you had a 4.0 or not, but we'll go with it. It sounds good. Class of 2001 from MTSU, Dr. Amy Shirley, owner of Family Pet Health in Murfreesboro, Tennessee. Dr. Shirley, welcome back to the podcast.
Thanks. Glad to be here and doing this webinar.
Yeah. So when these aren't your favorite things to do, are they? Like, you'd rather be elbow deep inside an animal.
Yeah.
Versus.
Yeah, I don't really like the spotlight.
So that's why we put you.
Opposite.
That's why we put you front
Michael.
and center of the podcast episode today. So for all of you watching today, what we're going to be talking about, our topic today is keeping your pets happy and healthy during the holiday season. So that's what we're going to get to today. So if you have any questions related to that, put them in the chat. We are excited to have a virtual live audience today for the Family Pet Podcast. Right?
Yeah, I'm
being quiet over there.
Well, I'm afraid, because anytime I talk, Stephen, I gotta make fun of him some more.
I do need to make fun of you some more. Well,
anyway,
we want to start by telling you a little bit about Family Pet Health. We are a fear-free certified veterinary hospital. Dr. Shirley, what does it mean to have a fear-free certified vet hospital?
So Fear Free is actually an organization that we are certified with, and the whole mission of Fear Free is to pride ourselves in being leaders in animal well-being. And so we think that the emotional health and mental health of pets, just like it is in people, is a part of your overall health and well-being. And a big factor in that too is that a lot of pets get really stressed going to the veterinarian. I like to think about it like a dentist or pediatrics, especially pediatric dentistry, where you have some kids that have had a really positive experience going to a dentist, and maybe they jump in and love it because they get treats, they get to maybe watch a movie. But if they've had a fearful experience, had a cavity filled, it can escalate from there to where you have adults as well, and kids that maybe need sedation for dentistry, a little nitrous oxide. And so we look at those things with our pets, and, sometimes we have them come in on medication. Sometimes we sedate them in the car because they're scared to come into a veterinary building. So we look at that and we try to treat and or prevent fear, anxiety, and stress in our patients.
What are some of the most common trigger points at a vet hospital that induce fear, anxiety, and stress for pets? Like just what comes to your mind? Maybe the top 3 or 4.
Right. Yeah. So it depends. Like in cats, just leaving the house, getting in a pet taxi, and traveling to the vet can be a trigger. Dogs that are more social, they may be happy other places, but not at the vet. And maybe it's because they've had a painful injection, they've gotten their shots. Also, too, just the smells, other pets and dogs and cats,
Like the waiting room.
noises.
Yeah.
Yeah.
I think that's one of the things. We just built a new hospital about 6 miles from the MTSU's campus. If you're coming back to the campus this weekend for the football game, swing on by, take a tour, look around here. You'll see some big differences. Number one is from the outside, you'll notice that we have outdoor seating and doors directly into the exam room, so pets don't have to go through the lobby. If you do come inside, you'll notice that we don't have seating in our lobby because the lobby is where dogs are sniffing each other or barking at each other. The phone's ringing. People are coming and going. It's just a mass chaos.
The waiting room of a veterinary clinic is never pleasant.
Right.
I can't think of a time that I'd had one. So when you all designed this building, we don't need seats in the lobby. Let's just come straight in and go straight into a room.
That's our goal. Or one thing we learned during COVID was that people are kind of happy to wait in their car, or not happy, but
It works.
acceptable. Yes,
It works
it's
to wait in your
acceptable to
car.
wait in your car. You listen to your own music at your own volume. Why did you want to practice fear-free vet medicine?
Well, a big part of even just owning our own practice is we wanted to build a place where we wanted to go to work every day. Like I wanted to love and appreciate my career. And so I wanted to have a positive work environment. And I think fear free lines up really well with positive work environment. Like it's more positive for our team. Because historically, even when I was trained as a veterinarian, there was a lot of holding pets down for, like, say, that nail trim. We bring them maybe back to the back treatment area. They're away from their family. And we bring them back and say, hey, it went well. But in hindsight, the dog was 3 people were holding the pet down to get the nail trim done.
Yeah.
And that burns people out. Even on the medical side, the team, it can be hard on your physical body. It's also really stressful for the pet and the caregivers. And so it just goes along with having a really positive workplace.
And so when our team is happy, we can provide better care for the pets. Yeah. Stephen, where our viewers today, if they're interested in learning more about fear-free, or maybe they're not here in Murfreesboro and they want to find a fear-free veterinarian near them, where can they go to find out more information about fear-free vet care?
You can go to fearfreepets.com or fearfreehappyhomes.com. Fear-free Happy Homes is specifically designed for providing that level or that style of care in your home, preparing the pet taxi. They give a lot of tips for cats on how to acclimate them to a pet carrier so that when you pull it out, they don't run away and hide. But if you're looking for a fear-free professional, then fearfreepets.com is where you want to go.
And we can put both of those in the show notes on the podcast, show notes for the webinar. I'm not sure how we'll do that, but we'll get to it.
You can write it,
You
just
type
hold it up.
well, you can type it in the chat maybe as we
that's
continue
right.
talking. Were you going to say something else?
Yeah, and there's stuff on their website that's not just about going to the vet. Like they've got training stuff, and there's also fear-free professionals on the grooming side, trainers. So even when you're picking up a dog trainer, you want to find someone that uses positive techniques, low stress handling, not using aversive punishment type techniques.
Good deal. Well, I wanted to introduce the concept of fear-free vet care to our viewers and listeners today, because we're going to be referencing that here towards the end of our topics today, because fear is a part of the holidays when it comes to pets. But before we talk about the emotional well-being of pets during the holidays, let's just talk a little bit about some of the health risks or hazards that are out there for our pets as it relates to holidays. Now, we just finished the holiday of Halloween.
Chocolate.
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 So yes, I could go with the
Halloween holiday.
Yes, I had to figure out one way to work that into this.
He did it.
I got it done. Okay, so Halloween, the big risk that we think about with Halloween is candy and chocolate. So tell us a little now. Post Halloween, I know at our house, our very own house, the house of the veterinarian, the kids left the candy on the kitchen table, and I walked in, and there was thankfully just Twizzlers. Apparently, our miniature American Shepherd has a hankering for Twizzlers. They were everywhere, so she had gone and dug out all the Twizzlers of the bag. But what if that had been Reese's cups?
Well, she actually also ate
Oh.
some M&Ms.
Oh,
Yeah.
great! We found that too.
But it was one of the little snack, like really tiny ones. And so that's what you need to realize when it comes to chocolate is one is how much chocolate, milk chocolate is less dangerous than like a really strong dark chocolate with
Like
a lot
Baker's chocolate.
yes.
Okay.
So, and also the amount of chocolate. And so I knew given what there was very little chocolate and what she had actually consumed. Even that, if they eat enough of it, can cause like some diarrhea, vomiting. And then there's actually, we have if you call your veterinarian, we actually have a chocolate toxicity calculator. And so if you can notate that when you call your veterinarian, like how many grams of chocolate, what kind of chocolate, and we can put that in our calculator to let you know, yes, this does need treatment. No, this doesn't. You could just watch.
Yeah, it's like a little warning. It doesn't throw up like a car dashboard type of warning light.
It's like a little cartoon dog that will actually, in extreme cases, it'll show that dog seizing, having like a little cartoonish like seizure and death. And so it is a serious thing if they eat enough, chocolate, the caffeine, and there's also a chemical in the chocolate that's toxic.
And the treatment for that varies based on the levels and the type of chocolate.
Yes,
Okay.
and also how quickly the treatment can be started.
Okay.
Because if it's within 30 minutes to an hour, the veterinarian may recommend inducing vomiting, trying to evacuate those contents out of the stomach. If it's been too long for that to be effective, then there's other treatments. Sometimes you have to be hospitalization care, IV fluid therapy. Sometimes we give activated charcoal, which helps bind up those toxins if it's already in the gut and tries to keep it from being absorbed.
And is that free? Those treatments?
No.
No, it's not. It's
Prevention is always cheaper
that's
than
right.
treatment.
So that could get to be thousands of dollars depending on the treatment for these different
Correct.
toxicities that we're talking about. Okay. Anything else about Halloween, post Halloween?
Look for artificial sweeteners. Xylitol
Mm.
is in some candies, especially sugar-free gum.
And it may not say xylitol anymore. It may say it's like what is it called? Like there's different names now that they've rebranded xylitol as
Yes.
other things so that you don't freak out when you see it, but they're still just as dangerous.
Right. So it's always important to look at the ingredients. If your pet got into something that was not supposed to.
So sorry, I didn't mean to cut you off there.
No, go ahead.
No, just the prevention is the main thing. So look around, make sure your kids aren't hiding a stash of candy in their room that the dog will find or the cat.
I can't necessarily smell it. But my dog can.
Yeah.
For
Now,
sure.
Do we think about that a lot with dogs? Is the Halloween candy bad for cats?
It can be. Yeah. They're not as prone to getting into chocolate, but we had a cat that ate like a half a pan of brownies.
Yeah.
And we had to induce vomiting. So
What is going on at your house? Michael?
Well, I'll tell you, we feed our pets appropriately, so they're always kind of on the move for food. Yeah, they're not fat.
and this cat was in particular food motivated.
Yes, he was
So,
very motivated. Yeah, our cat.
a lot of cats wouldn't eat chocolate, but this one did. So
And then our exotic pets.
yep, I had a phone call yesterday from a personal friend in another state that her bird had eaten. Actually, her preschool age son had given her Amazon parrot a clove of garlic, and before she realized it. So again, around the holidays, you may have kids, you may have people in the house, and you may have exotic pets. So you do have to also think about them because garlic, interestingly, in a lot of animals, can cause your red blood cells to break down. So cats especially, but also birds, dogs, if they eat enough of it.
Is that what kills Dracula?
Yes, I was going to
Yes.
say. I was waiting for my joke about we were warding off the vampires for Halloween, and then we decided to give it to the parrot.
It
but
probably kills Dracula through hemolytic anemia.
okay.
Hemolytic anemia. I learned
there
something.
you go. You learned a little something.
That's
today.
where the red blood cells break down.
And so a lot of times it doesn't show up 2 or 3 days later. So you may think your
Oh.
pet's fine, and then then they're really, really sick.
Oh, wow.
Mhm.
Any questions in the chat yet?
So I've got some questions, but we're going to
Okay.
we're going
Save
to
'em.
come to the
We've-
overall anxiety.
Okay.
So we're going
Alright.
to circle to that.
All right, we're going to move on to my favorite, and it should be everyone's favorite holiday, Thanksgiving. Why is it my favorite? Because there's no pressure of gift giving or receiving, and you get to eat pumpkin pie and drink
Shout out,
boiled custard.
shout
And
out to my daughter Claire.
I don't
That's
know why
pumpkin pie.
anybody would choose eggnog over boiled custard, but some people do. But Thanksgiving is, as I just mentioned, it's like friends and family and food.
Lots of food.
And when Stephen and I have already had a podcast episode about this, but when I think about dogs eating food that they're not normally eating, I think of pancreatitis. And some of our viewers may have heard about pancreatitis before, but what is, like, can you explain it to me again, like I'm 5?
That's easy to do.
That's right. I was like, explain it to me like I spent 8
Like a
years in college.
no-brainer.
What is pancreatitis?
Yeah. So so the pancreas is like this little organ that sits kind of snuggled up against your intestinal tract and your liver. And people think about the pancreas and insulin. So it is like a gland secreting organ. And so it secretes insulin when you have a meal. But the other thing that people don't often realize is it also stores and produces your digestive enzymes. And so the classic pancreatitis that we think about in dogs when they eat like something really fatty, so they have a sudden onset of eating a fatty meal, it just overstimulates the pancreas to put out those digestive enzymes, and then there's such a outpouring of it that it actually digests itself. So normally those things aren't activated until they get into the gut, but but they already get activated, and so it starts pretty much digesting itself. And it can be anything from kind of mild stomach pain, vomiting to diarrhea, and best case scenario, it's a mild case, but it can be a very extensive hospitalization. It can trigger this huge inflammatory reaction that can go multi-organ failure. And historically, these cats or dogs, they either get better, with supportive care. That was our treatment. Supportive care basically means you're treating them for nausea, you're treating them for pain, you're giving them IV fluids to keep their circulation going, and then it's just a waiting game. There is a new drug on the market that's actually designed to stop that inflammatory cascade, so it's very targeted. So that's important to know too. If you think your dog has eaten a really fatty meal, high risk of pancreatitis, it's better to be proactive and get in sooner than later, because if you wait too long, that treatment's not going to be effective. If that inflammatory cascade that creates these disastrous pancreatitis cases, if you wait too long, that's not going to be effective.
Are there some breeds of dogs and cats that are more prone to pancreatitis than others?
Yes, so there are some genetic predispositions. We think about schnauzers; they're really prone to pancreatitis.
And so could it be something as simple, like when you say high fat meals? So I'm thinking of like the trimmings of the ham, the
Like
trimmings of the turkey
skin,
the turkey skin, and then
just
I
the
mean,
gravy. It's all.
yeah,
It's what
pretty much all Thanksgiving meal can trigger
Yeah.
this.
Yeah, and even nuts, like you wouldn't think about that, but high doses of a coconut oil, like especially the actual coconut, because people feed their pets sometimes coconut oil, which is fine in small amounts, but if they were to eat, large amounts of anything that's fatty, that could trigger it.
Sometimes the kids and I, you can go watch our TikTok account, Family Pet Health on TikTok. I made a homemade suet for the woodpeckers and things, and we used a lot of like Crisco oil and things, but we had to dry it. Like once you bake, like you cook it on the stove and stir it up, and then you put it in these little forms. It was just sitting out and thinking about like, what a disaster. I should have known.
going on in your house.
They did not, nothing ate it. It could have turned really, really poorly, like really bad. Then I have to explain that to Dr. Shirley, what has happened.
Yeah.
But you mentioned that pancreatitis can be mild. And so if your friends like, oh, my dog had pancreatitis and it was fine, or my cat had pancreatitis, but it was fine. That may not be the case for yours.
Right.
And it can be, like you said, multi organ failure and many days of hospitalization there, because I feel like we've seen some patients here that were here for months, like trying to fix. Not they were coming back and back.
Gracie suffered.
Oh yeah,
she was
that's
first
right.
diagnosed with pancreatitis.
Gracie,
in
for
January.
those of you that don't know, is Steven's old Shih Tzu that he had.
R.I.P.
Yes, right.
Because she suffered organ failure. It started affecting other organs, and it took 2 months before we realized. I mean, before it came to the conclusion this is not going to improve.
Yeah, and they can develop chronic pancreatitis, but a lot of times it's that acute one that can within a few days they can die from it. The other thing is you can have so much damage to the pancreas. Like if you lose 80% of your pancreas, then those patients a lot of times will go on to develop diabetes. And so they have to go on insulin and stuff at that point too. So much better to prevent than to try to treat this disease.
All right. We've brought gloom and doom to my favorite holiday.
That's right.
But
sad.
The moral of the story is prevent your pets from eating these high fat content foods and make sure that even though they're sitting there and begging and looking all cute, that you're not feeding them table scraps. Okay. All right.
So
anything else about any questions about Thanksgiving in there?
I don't have, I've got some general questions. We're going to circle to them. They're there. I see them.
Keep throwing those comments and questions in the chat box there.
But obviously we talked about Thanksgiving. We went Halloween, Thanksgiving. We all know what comes next. It's the crazy season, that 1 week of Christmas and New Year.
So the Hanukkah, Christmas, Kwanzaa connection where they all come together. No matter what you're celebrating,
something's going on in your house
in December. So with Christmas, I want to talk about 3 different things. I'm going to set us up here. We're going to talk about food, plants, and foreign bodies. So let's start with food. Anything more to say about Christmas food versus Halloween and Thanksgiving, what we've already said?
Yeah, I mean, anytime, I would also just do a little research. If your dog is eating something, you're like, could this be toxic? Because some things you don't think about, like avocado. Another one that people don't often think about is yeast dough. So if you're baking for the holidays, if they get into that dough before it's been cooked and they eat it, it can expand in their stomach and they can get bloated.
Oh my goodness. All right. So does the Pet Poison Helpline have a list of toxic? Can you look at that real quick?
The Pet Poison Helpline.
Pet Poison Helpline. All right. So food. So anything else on food?
No.
Okay. Then let's move to, I think about Christmas plants, like the Christmas cactus, poinsettias, all these things that go around Christmas, lilies as we get into Easter. What about plants?
Yeah, so poinsettias are really popular Christmas. And so they may be a novel thing to come into your house, which the pets are excited about. But
cats are like, oh, something to eat.
Yeah, can definitely upset their stomach, vomiting, diarrhea. Lilies in particular are extremely toxic. So thinking about peace lilies, Easter lilies, even if you have those outdoors and you've got outdoor cats, they say even just the pollen dust can be fatal to a cat. So that's very, very toxic.
Okay.
Yeah, people don't realize how toxic lilies are.
So as people are bringing their patio plants inside, be very aware that some of them could kill your pet.
Yeah. So kidney failure is what it does to cats. So.
Okay. Yes.
I'm on the Pet Poison Helpline, and I'm just on the Christmas things, and I've got some foreign body issues coming.
All right. Well,
I've got some ideas.
So for those of you, we did an episode of the Family Pet Podcast with the Pet Poison Helpline. Do you know
episode 75?
Episode 75. You can make a little note of that. It's a great resource that's out there, especially over the holidays. Your veterinarians may be spending time with their families, and they're not reachable. So you can look at the Pet Poison Helpline. They have a number that you can call, and you'll speak with a licensed veterinary professional who can help give you some guidance on the level of emergency that you're experiencing if your pet has ingested something. So anything else on plants?
The water.
Oh yeah.
I don't have cats.
Okay.
But I was told that the water around the base of the tree,
if you have a live Christmas tree,
can just be a toxic stew. So change that water out.
Pre-water. So Christmas tree water, if you have a live
it can
Christmas
have,
tree,
I think, pesticides and fertilizers and things in it. So
The
it's not
sap
good.
out of
the sap will move
the
down and
tree.
come up.
Yeah, it's just
And just stagnant funk water.
funky water.
Nobody wants to drink that except the
cat
dog,
does.
except the dog and a cat. So, all right.
Put a little tree skirt around the tree.
Christmas
over the water.
trees themselves toxic to the pets? Or just I know that anything can be toxic if you eat enough of it.
Yeah.
Okay. Nothing, no major
Not that I'm
concern.
aware of. I don't think
Okay.
there's.
All right. So we've talked about food. We talked about Christmas plants. Now I mentioned foreign bodies. So what is a foreign body? And what are some examples of Christmas foreign bodies that you have experienced in your career?
So, yeah, foreign body is just a general term we use in our field for anything that's not food item that a pet swallows. And
Okay.
so, yeah, historically, people use more tinsel on their Christmas trees, and that's a big, just don't even bring it in the house. That is,
Just
That just takes you back. Does it take you back to your childhood?
yes, because we had cats, and I don't remember
Mom-
which cat it was.
It was all of them. It was all of
we,
our cats.
We put the little the little
Silver-
tinsel
silver tinsel.
that you just throw up and it floats down, and the cats loved to
Eat it.
eat it.
Yeah.
And then a day later,
You would see
you
him
would see
running with
this
little
this tinsel
tray.
dingleberry coming out the back, and you have to get a paper towel and pinch it, and the cat would squirm, and you'd be pulling it out. And
But
that's the best case scenario.
exactly.
Yeah.
That's the
what's
good-
the worst case? Like, so people, we think it's a funny story. We had cats and
Yeah.
that happened all the time. What could have happened?
Well, strings are one of the worst foreign bodies, dog or cat. If there's anything that's like a string, or anything linear, they call it a linear foreign body, can kind of get hung up either in the stomach or the intestines. And then as it tries to pass through, it bunches up the intestines like an accordion. And then that tension gets strong enough, it'll actually perforate the bowel. So I've seen it, going in there. And those are just a nightmare with peritonitis, sometimes having to resect bowel. Sometimes you can't even fix it.
So I'm just gonna layman's terms here.
Mhm.
We run a string through the curvy
Mhm.
intestines, which pulls it all together, like tightening up your
Yeah.
shoelaces.
Yeah.
And then it can it can cut off the circulation and blood supply to the intestines,
Yeah.
which causes it
Or
to
just
die,
tear the
or
intestine.
cut through
Just
the
cut right
intestine
through it.
altogether.
Go through it.
and when you said you said you had to do what was the term?
So sometimes we remove a section of bowel.
Right.
So you remove that diseased portion and then reattach the
What did
other
you
two
call it?
ends together.
What did you call that?
Resection.
Resection,
resection, okay.
anastomosis.
Wait, what
Anastomosis.
was the second part?
Anastomosis.
Anastomosis.
That sounds like
So
what was that? What was the
uh,
Doc McStuffins? That's a Doc McStuffins term. Should
Is
we do-
it? Oh.
Yeah. Anyway, so
You left me.
yeah, you don't have kids that age
No.
back then.
No, I
And
do not.
maybe
I have
anybody
an
out there.
MTSU graduate. I don't
Oh
have-
yeah, that's right. So we would cut out the dead bowel and
Mhm.
resect or reconnect it. And is that cheap?
No. Yeah.
Okay. Is it easy?
No.
Is it fun?
No. And even as the veterinarian side, you sweat every night for a week after that. Don't wonder if there's going to be a complication. Like,
'Cause that has-
because there's usually at least a week before is that pet going to heal or not
Mm.
from an intestinal
I
surgery.
remember Dr. Nunnery did a resection, and she would not let me post
A
the
picture,
picture of the surgery because I was like, "Oh, it just went great," and she's like, "We are
Don't-
not out of the
Do
woods
not
yet.
jinx it.
We are not out of the woods." And then a week and a half later, when the puppy came back for the revisit and was bouncing all over, she goes, "Now you may post the
It's
picture."
really amazing that any of our pets growing up survived. I'll just
In our house,
Yeah,
yes.
So another foreign body that's really bad is magnets.
Oh.
So toys around the holidays, especially if you have multiple, like toys that have a lot of those magnets that stick together.
Mhm.
So if they eat those, a lot of times they will stick together in the bowel, and that will also perforate
Yep.
through intestine or stomach. And so magnets are a really bad deal.
I think
Yeah.
about, but in like the magnets on the toys are like super magnets. They're like
Mhm.
really strong. And so when you do that, you basically just we anesthetize the pet, intubate them, we're breathing, we got them all hooked up on the monitors, and then you're just cutting them open and you pull all the intestines out and try to find. Is it easy to find where the problem is?
Usually, not always. There are some deep attachments. So like when the first part of the small intestine called the duodenum comes out of the stomach, that's really deep down in there, especially in a deep chested dog. It might be a really hard location to get to. But yeah, the small intestine, we call it running the bowel. So you just take it out and you start at one end and you run your fingers through it. Yep.
Like the magician pulling this
Uh,
stuff out of the hat.
And then the stomach is a common place. Sometimes stuff gets stuck in the stomach, goes up the esophagus, and it's like actually underneath the tongue. So that's one thing I always look for, especially in a cat with a string.
Oh,
Is like
yeah.
you look in the mouth to start with.
Oh, wow.
Do you see a string?
That reminds me of a stick that you found in the roof of the mouth. It's like if your dog's chewing
Mhm.
on the Christmas tree, you could get a stick in there. You always start at the mouth, huh? That's
Yeah,
cool.
and just I mean, this is just a medical
Ooh.
interest, but with those linear foreign bodies, there are some techniques where you try to find the beginning of it. You open up the bowel and then you attach something like a long red rubber catheter, and then you feed that through the intestine so you don't have to make multiple incisions in the intestine. So you run it through internally and it catches the string and you pull it all the way through.
Interesting.
Mhm.
And people can find that on YouTube, right?
I'm sure they are.
So if you're really fascinated by this, just go to YouTube. Search what was the big word you used? for that?
Anastomosis.
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 All right. Enough about foreign bodies.
Well, the other
Oh,
thought that popped in mind
Just kidding.
too is a lot of times we want to also celebrate our pets at the holidays, and so we might get them a lot of toys, bones,
oh,
treats that we don't normally because we want them to have a good holiday. And so just be careful with that too, because at the very least you might give them an upset stomach if you're giving them a lot of treats, even if they're made for dogs or cats, if they're not used to it. I think we did pet grass for our cats one year and they overate on it, got sick.
they were like cows grazing on it. It was,
Which cat greens are very good
Yep.
in small amounts. And I think that's with anything. So with these treats. And then also toys, like a lot of dogs will chew the stuffing out of toys and that can cause a foreign body.
the squeakers.
The squeakers.
The eyeballs
Yeah.
off the stuff.
Cats will sometimes eat those little toy mice.
The whole thing.
Yeah. So you want to maybe look at that, like maybe get something that's too big to swallow for that pet, or do it with supervision, especially if there's any strings involved.
Yes, that's a good point. And the last thing that I'll mention on this is if you buy your dog or cat a chew toy, that can lead to other problems too, right? Like broken teeth.
Yeah.
So what is your recommendations on making sure you buy appropriate type of a chew toy?
Man, those are tough because dogs really love to chew. A lot of dogs do. And I've asked veterinary dentists about this. What is safe? And unfortunately, really, if it doesn't give to your fingernail pressure, it's too hard. Like, it's really popular to give them like these.
Bully sticks, pig ears,
Yeah.
nyla
And
bones.
some dogs won't chew too hard on them, but you really have to watch what your dog's doing. If your dog is really crunching hard, especially the worst things I've found are like deer antlers, because they don't soften at all and they will crack their molars. And again, like you're talking about pretty expensive treatments.
Because you have to remove that
That's
molar.
a surgical
Yeah.
removal. It's a 3-rooted tooth that's really big, and takes a lot of time and work on our part to take those teeth out. But if it's broken into the gum line or into the pulp cavity, those teeth need to come out.
And because they need to come out. Why? Because
Painful.
Painful.
Yeah.
Yep.
And infection. So if it can get in the pulp cavity, bacteria can get into the pulp cavity.
and mouths are nasty.
And we see a lot of times you don't even know it till they have an abscess, coming out the side of their face. They're like, oh, why is my dog's face swollen? And we're always like, oh, that's a tooth root abscess.
Okay. All right. So listeners, I hope you're hearing this. Like we want to love on our pets and give them and include them in the holidays, but make sure you're doing that appropriately. And if you have any questions, can they talk to their veterinarian about that?
Sure. Yeah.
Okay.
Like that was like,
Sure. Yeah, sure. Absolutely.
Talking about that.
Or they
Always.
just share this episode of the MTSU Alumni webinar / Family Pet Podcast with a friend. All right, we're moving on to our next holiday because we're running out of time. The next holiday is New Year's. Yeah.
I'm not questioning that part.
Oh, it's like, why are you looking at me like that? Okay, so New Year's, what's the big risk or hazard for our pets when it comes to New Year's?
Yeah. I mean, I guess the fireworks, again, around the 4th of July, anytime there's fireworks, there's a lot of stress and anxiety in our pets. And I think just being proactive, like talking to your veterinarian, maybe having things on hand, because sometimes you don't know how stressed your pet's going to be unless you have a history of it.
Right.
And some people will start with just like, oh, I got some calming treats, but what we found is a lot of times that's not strong enough. Like some pets, if they're just mildly anxious, put them in a quiet room with some white noise. Um, there's a lot of tips out there for minimizing stress. But sometimes you don't want to be in the middle of that situation and need something stronger. And it's the middle of the night and your vet's not open. You know, you need to have something on hand.
So when you think about New Year's, you're thinking more the main risk to our pets is more of their emotional health, okay, mental health for our pets. And that is a good lead in to the next risk that I see for all of these holidays, which is house guests. So we have a lot of friends and family come to our houses that normally maybe don't come, or our pets haven't interacted with them. The doorbell's ringing, people are knocking, it sets our pets off. Talk to us a little bit about how we can help manage our pets' emotional health, social and emotional health through the holidays as it relates to new people and new routines.
Sure. And I think one is just noticing your pet's body language. Like if they're panting heavily, they're visibly stressed, you know, then put them in a quiet space. Like don't feel like they have to be a part of all the commotion. It may be safer for them, better for their emotional well-being, just to go into a bedroom with some things and just try to, even medication if needed, like if they're going to be back there barking, you know, just make sure they have a safe, calm environment to go into. And then just good communication with all the guests, because, you know, there's going to be a lot of people, maybe set boundaries ahead of time, like, because they may not know not to give your dog a treat or something off the table.
Turkey, yeah.
Or
And,
Robin in the chat says and reminds alcohol. That
Alcohol, yep.
And also the other yeah, depending on where you live in the country.
Yeah,
So-
yeah, and so that is actually a really common emergency is marijuana toxicity, and so that's a real thing too. They can ingest it, you know.
And if it's chocolate brownies with
Right.
marijuana, then it's like a triple whammy.
Just bad. Just
It
bad.
just makes them want to eat more.
But I was thinking about even like one time this does make this look bad, but
Do as we say, folks, not as we do.
son said he came in and our smallest dog had eaten an oatmeal raisin
Oh,
cookies.
yeah.
And I was like, he had gotten it at some event, like an agriculture event or something. And so I was like, oh, it was probably just a little cookie, not a big deal. But I was proactive. I didn't take her in to our veterinary office, and we induced vomiting. And there was no kidding, like 45 raisins.
In one cookie.
And we haven't mentioned raisins, but
Sounds
raisins
like a
and
really good-
grapes.
Wait, this
be
is
very-
important. Wait, say that. Wait, start over.
So we didn't mention before, but raisins and grapes are toxic.
Big ones.
To some dogs.
Yeah.
Yeah. And it can just take a very small amount. So, but if he hadn't, I was just thinking of in that situation, like he knew that raisins were bad, but not every niece or nephew or grandchild that you have at your house may not know that.
They may
And
just share.
so-
Yeah.
Yeah. And so you need them to say, okay, if you saw my dog eat something, you need to tell me, just because they may not know that that's a problem.
And they're probably not going to offer to help pay for the pancreatitis treatment.
That's right.
Yeah. So, all right. So the other thing about house guests that I want to mention is that not only that they may introduce food to your pets, but that they may come and spend the night, and maybe they don't have pets at home. So they might have medications that they travel with that are out on the countertop or by the bedside the nightstand bedside table. And they may not tell you that they have medications, but sometimes people will open up their meds and put the pill on the counter. And then if you have a counter surfing pet, they may come and eat that pill. And human medicines can have effects on our pets, correct?
Yeah, 100%. I mean, this is a problem we have definitely seen like in real life, like this happens. So, yeah, good communication if you have house guests. And if you're thinking about taking your pet to a holiday event, I would just say, look in the mirror at yourself really closely before you take this decision, because it may not be the best thing. Like really say, is this the best interest of my pet, everybody else involved? Because you may be like, my dog gets along great with other dogs. My family has dogs. But sometimes in that environment, there may be conflict. Your dog may get along with dogs at a dog park, but if you're going into another dog's environment where their food dishes are, their bed is, all this commotion going on, we see a lot of dog fight wounds around the holidays too. Just to tell you what we're seeing, I'd say the most common things we see are diarrhea. A lot of times that's stress related.
Okay.
So vomiting, diarrhea, stress, and wounds from dog fights.
Stephen, talk about give your ProViable commercial here to the listeners today. Everybody, listen up, listen up.
Yeah, if you've just got a situation where one of the things that often results in stress in a pet is diarrhea, and if you have an opportunity to buy a anti-diarrhea medication beforehand, it's an over-the-counter. ProViable is what I have 3 boxes in my house. I just buy it.
yourself?
I buy it in bulk for my dog Maverick, who's 60 pounds, because when he has diarrhea,
It's an event.
you just don't want it.
And not a good one.
And so I just want to have that on hand, ready to go. That the moment he's got it, there's a little paste. It's like you measure it out and squirt it in, and it just kind of absorbs the water in the gut and kind of solidifies the poop. And
Listen to you
It's
go.
work.
You're like,
Hey,
I'm telling you, I knew you
on
wanted
this-
to talk about
on
it.
this topic, I am an expert.
Well,
'Cause
this happened to us too early in our marriage.
Oh,
We
yeah.
took
you had diarrhea.
Tadpole, the dog in our logo.
Yeah, we took his dog to my grandparents for a
Oh.
holiday, and we're like, she's a good dog. She's good to travel. We'll take her. This will be fine.
Honestly, I didn't want to pay for boarding.
Yeah,
Right.
Yeah.
And she got stressed, maybe ate something she shouldn't have. I don't know. But we just know in the middle of the night on my grandparents' white carpet, she had diarrhea in the room we were sleeping in. So,
Oh, it
yeah, this
smelled-
is not things you want to deal with.
Yeah,
on
we
the
woke
holidays.
up to the smell, and I looked at her, and she looked at me, and I was like, "It wasn't me." and then, it was not pleasant. Not
So
pleasant.
you may want to really look at, can you find a good pet sitter? Can you look into boarding? Boarding can be stressful too. So you may want to have that ProViable kit, even if your pet's going into boarding, but trying to look for a low stress environment.
You were just give me a high five for these segues. Let's talk about boarding for just a second. If our listeners, viewers are thinking about, okay, they're like, hey, you sold me. I'm not traveling with my pet. I'm going to put my pet in boarding or have a pet sitter. But let's say that they're going to go boarding. A lot of the boarding operations will require certain vaccinations. One in particular, Bordetella. Tell us a little bit about that, and why do these boarding operations require vaccinations?
Right. And that's not what any boarding facility wants, is to have an outbreak of a respiratory virus. And that's kind of what it is. There's like a canine respiratory disease complex. Bordetella is a bacteria. That's one of the things that can cause kennel cough. Kennel cough is another old term kind of used. But that's just one of the things. A lot of times it can be a virus. There's canine influenza, there's para-influenzas, a host of other things that can be contagious. It's just like an upper respiratory infection.
All right. And all listeners out there, especially if you're in Tennessee, you have to, by law, have your pet vaccinated for rabies. It is a zoonotic disease, which means that, Stephen?
it can be passed from animal to human.
Very good. And rabies in particular is fatal. So we do not want to
Absolutely.
mess around with that. So make sure that that your pets are up to date. We've talked about traveling. We talked about boarding. We're running out of
Yeah,
time.
and I would say again too, with just the boarding, like when you're seeing if your pet's up to date on vaccines, if you have to go to the vet for those vaccines, also talk to them about if you think your pet's going to be stressed. So I would say unless your dog is just super happy-go-lucky, no matter where they are, it's going to be stressful being away from home in a boarding facility. So you may want to talk to your vet about, is there something that can be done to help minimize that?
And that might be going ahead and sending them with some anti-diarrheal medicine like ProViable, but it also might be sending them to boarding with some medication.
Yeah, and it can even be supplements. We use a lot of,
Okay.
Adaptil here, which is a pheromone that's calming. They make collars and sprays for that. There's also some calming supplements, and then it can go up from there. So if your dog is really stressed, it probably needs a, medication for that.
Okay. Dr. Shirley, I know that you have a 12:45 appointment. That's 1 minute away. Is there anything that Dr. Shirley has to answer on that in the chat box?
The number one thing is questions about anxiety, separation anxiety. What do they do? What do pet parents do whose pet is suffering from anxiety, separation anxieties?
Oh,
So-
big pause. That was I don't know if our listeners could hear that. There was a pause and a sigh.
and a
I was
breath.
like in 1 minute. No, like separation anxiety is a whole podcast episode.
Actually, we have a podcast episode about that. We'll
Yeah, yeah. So separation anxiety, and I don't know what context you're talking about. If you're talking about like leaving them at a boarding facility, or if you're, do you have a specific?
It's a daily leaving them at home.
Leaving them at
One
home.
room apart. The dog's got to be
Gotcha.
with them.
Yeah,
Yes.
that's a
That's a
trainer.
hug to your vet.
Yeah. Talk-
And work
yeah.
with a trainer sometimes. We do have a client that's working with us and their trainer. And that's the best situation. So, because because we can medicate a dog for separation anxiety, but if you don't combine that with behavior modification, it's not going to be as effective. You're not going to be happy in the long term if you don't also train them to be comfortable being alone.
And for those of you watching or listening, that's something that is whether we like it or not, puppies are given as Christmas gifts often, and just go ahead and start now in training them properly so that you can avoid separation anxiety and other behavioral issues. I feel for that person because I know what that's like to have a pet like that. As we've had many foster dogs that have come through our house that needed help, and it had to step up. Besides just training, it was training and medication. We had to use medication to get their anxiety down so that we could then train them so that they would learn that it was safe.
A lot of times they learn better if you're medicating. So don't be afraid of medication. Like,
give drugs a chance.
give drugs a chance. Yeah.
Dr. Shirley, thank you for your time today on this webinar / podcast of the Family Pet Podcast. I'm going to mute your mic and you can set everything down. And I know you've got to go to your appointment.
MTSU, so
that's right.
you guys.
Family Pet Health would not exist without MTSU. And so we were happy to do this today. Thank you, Dr. Shirley.
Thank you.
All right, Stephen, I'm muting her mic. We're
she's out.
down. Are just you and me going to answer these questions? What we got?
Well, I mean, we've got some podcast episodes
That's
that
right.
have previously addressed some of these, but as we go through, and we might get a special follow-up guest appearance.
Dr. Sam, so we have 5 doctors here and 4 are MTSU alum.
That's right.
So we are Blue Raider through and through here at Family Pet Health. So if Dr. Shirley's walking out, if she's available, send her on in. We'll get her down here. We got a few more minutes. We got about 13 minutes left.
All right. So I did want to circle back. We had a comment from Robin who talks about FAS and cats.
Okay.
And she echoed and reiterated the training with the cat carrier. And you have cats, you have carriers. Talk to the listeners, talk to everybody out there. What is the 3 steps that you would recommend?
Well, first off, go to YouTube to the Family Pet Health, search for Family Pet Health. We have a training video on how you can train your cat to go into the carrier. The number one thing that I would say, the number one mistake that we hear and see people make when it comes to getting their cats in a carrier is that they only bring the carrier out of storage when they're going to take their cat on a road trip. Or like when you're putting them in the carrier to get them in the car to take them somewhere. So what I would recommend is, get one of these over here. What I would recommend is getting a carrier that doubles as a pet bed or a little hidey spot for them, and leave it out all the time so that your cat isn't terrified of the carrier. And now Stephen just brought up one and set it up here, and he may put it in front of the camera a little bit better. This is called a sleepy pod. It's this one that looks like an igloo, and it doubles as an actual cat bed. So, and you can use it for small dogs too. But we just leave it out all the time, and it's fleece lined in there, and that's where the cats we just set it out wherever your cat likes to chill, and they'll get used to being in that. The other thing about the carrier, if you have one that's like this one, this is also a sleepy pod. It's designed for air travel. You can fold up the lid here, and you can actually just start playing games with your cat where you, especially if your cat is food motivated, where you start feeding them in the carrier one little kibble at a time so that they learn that, oh, I can go in here, get a reward, come back out as I want, so that it's not a terrible experience. What the goal is that when you call your cat will come running and get in the carrier. We, in Tennessee, we get severe weather here often throughout the year. And our cats are trained to come into our room where we stage, and we get them in their carriers, and then we all go to our storm shelter. And the cats, they don't particularly love that, but they're not totally stressed out by that. So you have to make a deliberate effort to train your cats to get in the carrier, and it is not that hard to do, but it does take some effort. So
we talk often, and you've heard it repeatedly, that prevention is key. The second thing that you've heard over and over and over again is acclimating or training or desensitizing. So getting your pet used to whatever it is that that causes the fear, anxiety, and stress that causes the problem. So if you've got fireworks that we talk about acclimating and desensitizing is we recognize. So one of the things you can do is play very, very soft firework sounds leading up to it and have that as your playtime with your pet. So they actually associate fireworks with time
Good
with
things.
you.
Yeah. All right. We have replaced Dr. Shirley. I won't say upgraded or downgraded. We have replaced Dr. Shirley.
Open yourself up for
with
that.
Dr. Samantha Nieves, MTSU class of
God, 2016.
2016. And you played softball. You were a scholarship softball player for MTSU, right?
I did. I played there 4 years.
Excellent. And a very accomplished. You can Google her. She's got like a Wikipedia page and everything.
Third
And-
base,
Yeah.
right?
Shortstop.
Shortstop.
And then I moved to third my
Oh.
last year.
Okay.
There you go. How did I've asked you this question before, but how did playing collegiate sports prepare you for a life as a veterinarian?
Oh gosh. Well, working with the team,
Yeah.
right? Because all vets have a team working with them. You have assistants, you have techs, and learning how to work with a bunch of different personalities and still being able to accomplish the goal that you guys set out. So that's really important, and learning how to just work together and set aside any differences you have and just kind of keep that common goal
Yeah.
in mind.
Well, Dr. Sam, a little story about her. She was in California and decided to move back to Middle Tennessee and just out of the blue said, "Hey, you guys hiring?" I'm like, "Is this a joke?" "Yeah, we're hiring." So we just added to
And
our
you're an MTSU
and you're an
grad?
MTSU, and she had already read the Energy Bus, the book.
Yep.
So she was a natural for us. We're just answering some audience questions right now.
Okay.
So we've talked about anxiety in our pets. We've talked about it at home with some things with cat carriers, with fireworks. Talk about actually coming to the clinic, to a veterinary clinic, what an owner can do and help their pet through that process.
Okay. Dog or cat? Either one?
Yes.
Okay.
Yes, yes.
Well, I guess we could start with dogs. First thing, well, hopefully we worked on socialization when they were a puppy and getting them used to new places and new people. But if not, and they're a little nervous coming into the vet clinic, setting up some happy visits with your current veterinary clinic, if they offer it, where they just come in and walk around and everyone gives them a treat and they kind of learn that the vet isn't that scary of a place to come. And then if they are acting anxious at that time, we might talk about, well, maybe they might need some calming medications before to kind of help them settle down and make the process a little bit easier. Bringing your pet's favorite treats to the vet clinic helps out and kind of keep them motivated on the food, a little distracted instead of them focusing on what's going on in the vet clinic. And then, I would practice handling them at home too. Like hopefully we're playing with their ears and playing with their feet and getting them used to just being touched and handled by a bunch of different people, so they're not super uncomfortable when we get up in their face.
And so that's desensitization. Okay.
Oh.
Help me out.
Desensitization.
Desensitization. There we go. That's where we just introduced the activity at home that is going to be done at the clinic. So when I do with Maverick is give me your paw, and then I squeeze his paw just to let him.
We
get
need you to
used
start
it.
working on him with shots.
Dude, I'm not going anywhere near that dog when the shot comes out.
So yeah.
Yeah. Kind of the same thing. Counter conditioning, desensitization. That's a lot more training focus with the actual intention in there versus trying to get them used to just being handled and touched. But yeah, happy visits is probably the way to go, at least for the dogs. And then for cats, getting them used to the carrier, because a lot of cats don't go into the carrier unless they come to the vet. And so they already have that negative association. So I think a big part is just leave your carrier out in the house get the top off of it and put a blanket in there so it's more like a bed, so they're comfortable with it. And
Wow, Michael, it's like you took advice from a doctor when you gave
I've been listening to you, Dr. Sam. So that's good. And
Yeah.
don't store it in a closet or in the attic and then bring it out only when you're
Yes.
going to the vet. Yeah.
yes,
Yeah. Or the garage.
yes,
Good.
which is what I do with my cat because he's obsessed with his carrier.
Because he won't get out because you've trained him so much. He sees it and comes running because he's going to get a treat.
Yes.
Yep. That's the goal.
Yes.
So yeah, that's good. All right, Stephen, got another question for us?
So we also have questions about the separation anxiety. We talked about that's a combination of medication and trainer. That is
Mhm.
that is something. And so again, just reiterating that the advice there, if your pet has severe separation anxiety, that is a long-term discussion with your vet and with the trainer.
Yeah, preferably behavior certified trainer, like a CP, whatever the acronym
Yep.
is for it. But there are trainers that have gone through training and have certification specifically to deal with pets with behavioral issues, not just commands and obedience training.
All right. So again,
It's a CPDT,
Yes.
certified pet dog trainer.
Yes.
Yep.
So we're bringing Dr. Sam in blind on this, so she wasn't part of our previous conversation. We talked about chew toys and chew treats, and we have a question about. So we talked about in chew toys that being mindful that hard toys can break teeth. So being mindful of the toy, but they're asking about the chew treat and specifically rawhide treats. And I
Remember the part about foreign bodies, folks? Yep.
and that's what the question was, and I said rawhide treats can be tricky. Dogs will often chew the treat down, but then swallow it before it is at an easily digestible stage. Your thoughts on rawhide treats?
I'm not supposed to recommend rawhides. One, for the foreign body risk, and two, from a food contamination standpoint, because it can be contaminated. Just any dehydrated treat like jerkies aren't recommended to be given to pet just because they carry that risk of, I guess, food poisoning. Rawhides specifically, I feel like there's way too many issues for us to even risk.
And our viewers and listeners may be like, man, these guys are real downers. We do see, I mean, this is what we do. So we see the worst cases.
This is based on the bad outcomes. So the positive, what can I give a pet who likes to chew maybe as a calming right before bedtime? What am I going to do?
Food toys are the way to go. Using a Kong, or there's a toy out there called a pickle pocket that you kind of stuff treats in.
Okay.
You can put some peanut butter in there, stick it in the freezer, and freeze it so it lasts a little bit longer. So they're working a little bit harder with it. If you aren't feeding your pet through food puzzles, I'd consider doing that. There really isn't a need for a pet to eat food out of a bowl. They could be working for their food all day if they want to, and just have them, roll around a little puzzle toy.
So you can give your dog a Christmas present and it can be a food puzzle.
Yeah.
There you go.
Yep. You do have to train them to use
is
it.
true.
Otherwise they're going to get frustrated and they're not going to
Maverick
even
took
bother.
the one and just
No, it was a wobble.
it was a wobble.
It was
and
the food
ended
wobble.
up breaking it.
He threw it up in the air because he realized it would come apart and then all the food would come out. So, it was
So he
pretty
just
fun.
broke it.
Well, for those of you that haven't ever listened to an episode of the Family Pet Podcast, we have a little section in each episode called the Fun Fact. And this is something that it's a trivia, a fun fact that will help you win trivia night at your favorite local brewery, like Cedar Glade Brews, sponsor, a big MTSU supporter here in Murfreesboro, or impress your friends and family at one of these family dinners, like Christmas or Thanksgiving. So I have your fun fact, and it is MTSU themed today.
It ought to be for the MTSU
That's right.
alumni.
Dr. Sam, did you major in horse science? Or animal
science and biology.
Okay, but you spent a year as a equine veterinarian, right?
Mhm.
Did you know, this is your fun fact, that one of the foundation walking horses, the foundation stud, the male that established the breed of the Tennessee walking horses, his name was Wilson's Allen, and he grew up with old just down the road in Beech Grove. But did you know that for a long period of time he was buried right outside of the ag building, the Stark Ag building at MTSU's campus.
I don't think I knew that.
And he was moved. He was buried on his farm in Coffee County there in Beech Grove, and was moved to MTSU in 1975 and buried right outside of the Stark Ag building. They had a big ceremony, like big wig people from the state came down, and they had this big ceremony where they reinterred Wilson's Allen bones on the
Okay.
campus of MTSU. But did he get to rest there?
Not resting.
No, he did not. He got moved again when they built the new nursing building. That you probably only know it as the nursing building. It was built when I was in school, and so we had to move him. So they dug him up and they moved him over to the Miller Coliseum's ground at the New Horse Science Center on Thompson Lane. So that's your fun fact trivia, is that there was the foundation sire, one of the foundation sires for the Tennessee Walking Horses Breed Association was Wilson's Allen, and he was buried for a time right there in the heart of MTSU's campus, but no longer. Now he's out on Thompson Lane. So, all right. Any other questions before we go?
That's got it.
That's it. Well, we hope that you all have enjoyed this joint episode of the Family Pet Podcast, a podcast for curious pet parents. We hope we've taught you a little something, and we're going to turn it back over to our friend Rachel Helms from the MTSU Alumni Office. Thanks again, Rachel, for having us.
Oh, thank you. It was fantastic. I learned a lot. I really appreciate y'all doing this. And I just want to thank everybody for joining us today. This webinar has been recorded, and I will be posting it on our MTSU alumni website. And I'll send that link to everyone that has registered, along with some information about the Family Pet Podcast and Family Pet Health. Also be sending out a little survey. I'd love your feedback. It just takes a minute to fill out. Our next alumni webinar is on December 10th. It's called Thriving Through the Holidays, Nourishing Your Body with Healthy Eating, presented by Christina Bird and Sarah Nicolette of the MTSU Center for Health and Human Services. You'll just go to mtalumni.com to register. That's it. Thank you again, all, and have a wonderful afternoon, okay?
Until next time,
Until
go
next
Blue
time.
Raiders.
Oh,
Stay curious and go Blue Raiders.
Go Blue Raiders. Thank you, guys.